Today I'll tell you about how to use the dental sculpt lift to fix class 3 malocclusion without surgery. So this is a great option for patients who have class 3 malocclusion. They have an underbite and they don't want to go through the surgery because it's painful, obviously. So we can fix class 3 occlusions cosmetically and functionally without surgery. And so the sculpt lift is named that way because we build the teeth in the mouth, but it's essentially just restorative work that's going to fix the occlusion. This is something I first learned from Dr. Appa, who does it all the time and is very good at it. And so I'll show you a few cases and the philosophy behind it and how it works. So if we look at this first case, this is a patient we finished already. So this is his first bite. He's got an open bite and class 3 occlusion. So if we look at it from the side, his lower teeth are in front of his upper teeth, right? The first thing to mention is that a lot of the times these are kind of pseudo class 3s, where it's not as much of a class 3 as we think it is when we deprogram them. But either way, this is the end result. So we have beautiful teeth, obviously, and then we have him in a class 1 bite, not molar class 1, but incisally class 1. And so this is the models there. This patient we delivered these a couple of days ago, so he hasn't come back for his post-op photos, but you can see from the models that he has a natural overbite now, and his bite is more comfortable than it used to be. And so the philosophy behind it, so if we look at this diagram, right, this is where his maxillary incisal edge is, and this is where his mandibular incisal edge is. And now as we open this person's bite, because it's hinged on the TMJ, it moves back. As it opens, it rotates, right? As we know for the jaw, it rotates and then translates. So in the first 30 millimeters, it's going to do a pure rotation. And as it rotates, it moves back. So this person's a severe class 3, but it shows the concept, right? If I bring them all the way back to here, and now I bring up that same first line, now the line goes from here, where it initially was, all the way back to here. And so what you can do is you would never open it this much, but you can open it slightly to get a little bit of posterior movement of the anteriors, and then you can also reshape the incisal of the lower anteriors to bring it back more. This obviously needs to be done in CR, and this needs to be done with proper occlusion so that their bite feels better afterwards instead of worse. But this is a very easy way to correct class 3. If we look at this case that I just did 30-40 minutes ago, these are just temporary. So I just did these by hand. This is a mock-up, right? Sorry, not temporary. So this is just a mock-up. She came in, she was interested in fixing her bite. I did this half an hour ago, so I don't have a lot of photos yet, but these are her models. So she's in a full class 3. And she was trying to find a way to not do surgery. And so we mocked up her uppers to see what it would look like. And from the side, I made sure her bite was open with my mock-up. And from the side, you can see that her bite is fully corrected just from opening her bite. So this is great for slight class 3s and pseudo class 3s. If they're extremely class 3, obviously you're not going to be able to get this. The best you can do is end to end, which sometimes is very valuable to the patient. And another last important thing to note is that their chin profile, right? The last patient I just showed you, who was just in here, is not worried about her chin profile. If they are, an option they can do is have their bite corrected, have the class 3 corrected with restorative dentistry, and then they can get a genioplasty, which moves their chin in, right? Just chin cosmetic surgery. And it seems like that's a lot, but it is a lot of the times better than the alternative of having a full jaw surgery where they reposition the jaw. So it doesn't work in all cases, but it does work in quite a lot. There's very few true class 3s that actually come into your office that can't be fixed this way.